What is a psychotic disorder? Psychotic disorders are a group of serious illness that affect the mind. They make it hard for someone to think clearly, make good judgments, respond emotionally, communicate effectively, understand reality, and behave appropriately. When symptoms are severe, people with psychotic disorders have trouble staying in touch with reality and often are unable to handle daily life. But even severe psychotic disorders usually can be treated. Types. There are different types of psychotic disorders, including schizophrenia. Schizophrenia is one of the most common types of psychotic disorders and often has a genetic component. It can cause hallucinations, seeing or hearing things that don't exist. Delusions are also possible, where you might believe things that are untrue. Schizoaffective disorder. Schizoaffective disorder is a condition where you experience both psychosis and a mood disorder. It's most notable for its mood disorder traits, such as depression and bipolar disorder. It can also cause hallucinations, paranoia, and delusions. Bipolar disorder. Bipolar disorder is a type of mood disorder that's often characterized by cyclic changes between extreme highs and lows. Symptoms of psychosis may occur during manic episodes, where you might experience a combination of hallucinations and delusions. Catatonia. 10% of people with mental health disorders have a psychomotor syndrome called catatonia. While once considered a subtype of schizophrenia, catatonia is now recognized as its own mental illness. Substance use disorder. Misusing drugs or alcohol is strongly related to the development of mental illness later in life. People in their early 20s with substance use issues may be especially vulnerable to the development of psychosis since their brains are still developing at this stage of life. Other conditions. Sometimes psychosis may stem from depression, neurological disorders, and traumatic events. In other cases, certain aspects of psychosis may cause standalone symptoms, such as the case with delusional disorders. Symptoms. The symptoms of psychosis can vary between mental health disorders, but below are some possible signs: concentration difficulties, brain fog, increased anxiety or agitation, loss of interest or joy in your normal activities, increased or decreased appetite, hallucinations, where you hear or see things that seem real to you, neglecting personal hygiene, holding strong beliefs that aren't actually true, paranoia over people and situations around you. Causes. There's no one cause of psychosis. Genetics and brain chemical changes are strong links. Traumatic events, substance use, and underlying health conditions can sometimes lead to changes in the way your brain works. Treatments. Most psychotic disorders are treated with a combination of medications and psychotherapy, which is a type of counseling. Medication. Antipsychotic medicines are usually recommended as the first treatment for psychosis. They work by blocking the effect of dopamine, a chemical that transmits messages in the brain. Older antipsychotics include. Antipsychotics can usually reduce feeling of anxiety within a few hours of use, but they may take several days or weeks to reduce psychotic symptoms such as hallucinations or delusional thoughts. Side effects. Antipsychotics can have side effects, although not everyone will experience them and their severity will differ from person to person. Side effects can include drowsiness, shaking and trembling, weight gain, restlessness, muscle twitches and spasms, where your muscles shorten tightly and painfully, blurred vision, dizziness, constipation, loss of sex drive, libido, dry mouth.